How inequality gets under the skin and impacts our lives and ultimately our deaths is what I want to cover today in this afternoon's talk. And at the heart of this are two fundamental points, one that's well known, one that's slightly less well known. The first one's obvious. Where we are in the socio-economic order impacts our health, it impacts our lives. Economics gives us resources, which enables us to get better houses, better jobs, and allows us to mitigate the risks of a hostile world. But the other way in which inequality impacts our lives and ultimately our deaths and gets under the skin is through social comparison, and that's what I'm going to be talking about this afternoon. How we feel about our place in the social order, how we feel relative to others also impacts our health. And the feelings of shame and failure that can follow for those further down the social order as a result of those feelings, those social comparisons, is what I'm going to talk about. But first, a bit of context. We all think about life expectancy as improving, don't we? Life expectancies, it's a common assumption throughout, certainly my generation, that life expectancy would improve. But that is something, of course, that COVID has changed for us all. We all know, as you can see there, that COVID, if you look at the figures there of life expectancy in English regions, has hit our life expectancy in England. There's been a decline of something like 1.3 years for men and about 0.9 years for women. But look a bit closer. What do you see there as well in some of those regions? For those people who are from the northeast, you'll see, going back to 2017, that there was actually a dip in life expectancy prior to COVID, but it was only affecting certain groups in the population. So you can see that here. We've actually seen decreasing life expectancy prior to COVID. This figure shows very clearly that there's a decrease in life expectancy between these two data points, which are 2013 to 15 compared to 2016 to 18, for females living in the most deprived 10% of areas. A shocking fact, life expectancy was declining prior to COVID for some groups in the population. So what's behind this decline in life expectancy? I would point to inequality. A lot of other scholars would also point to inequality as well. Increasing inequality, social inequality, income inequality, wealth inequality. And this is the crucial bit, the discourses and practices that underline the changes that we've seen in the world over the last 20 to 30 years. And if you look at that fact there, that quote there, which is going back to 1990, it's an astonishing statistic. The loss of life from income inequality in the US in 1990 was equivalent to the combined loss of life due to lung cancer, diabetes, motor vehicle accidents, HIV, suicide and homicide. Absolutely shocking, and yet not that well known, I would suggest. However, I think that point is changing. What we know now, thanks to a number of academics out there, in particular Richard Wilkinson and Kate Pickett, through their really pioneering works, the spirit level and the inner level, they really have demonstrated how social inequality gets under the skin and impacts our health and ultimately our deaths. And what do they say? Well, here's a very simple description of their core argument, and we'll see a bit more about that as I go through my slides this afternoon. Essentially, health is related to income differences within rich societies, but not to those between them. What does that mean? Essentially, this graph is comparing life expectancy by deprivation, by the index of multiple deprivation. And you see that the most deprived groups have a much shorter life expectancy than the least deprived groups. And just to put this into context, really frightening context, there's an 8-year difference between the most deprived and the least deprived. Thinking geographically, I live in Manchester. For those people who live in Blackpool, Liverpool and Middlesbrough, it's a similar sort of difference, about 8 years. As compared to living in Westminster, Kensington or Chelsea. But more shockingly, if you think about the homeless, if you're homeless at or around the time of your death, if you're a man, you'll live 31 years less. If you're a woman, 38 years less compared to the average. A hugely shocking figure. That's back to the kind of life expectancy figures we saw in the 19th century. So that, I think, is one of those facts, a depiction of our world as we see it today, which is utterly shocking. Why do we see it? Well, Richard Wilkinson and Kate Pickett, in their groundbreaking book, The Spirit Level, would argue that the more unequal societies are more dysfunctional. So they would say that if, for instance, a country does badly on health, you can predict with some confidence that it will also do badly in terms of imprisoning a larger proportion of its population. It'll have more teenage pregnancy, lower literacy scores, more obesity, more mental health problems. Inequality seems to make countries more dysfunctional. And you can see this here. This is their index of health and social problems, which they've mapped against the levels of inequality and compared countries. And you can see the more unequal countries do much worse against that index of health and social problems, with America far away the worst there at the top on the right, and Japan and the Nordic countries doing much better. Again, it's a fundamental truth. What you see again, if you look at life expectancy, the same pattern is exhibited, that those countries which have lower levels of income inequality do better. Levels of trust are higher in more equal, rich countries. Infant mortality rates are higher in the more unequal countries as well. It's a predictor of health outcomes and social problems, Richard Wilkinson and Kate Pickett would say. And coming back to COVID, where we started, we see the same sorts of pattern. In the most deprived areas, death rates, age-adjusted deaths per 100,000, were higher than those in the least deprived areas. So that's a really important, I think, illustration of the shape of our world and the impact of social inequality. Why do we see this? Well, I've said a little bit about how obviously income matters, but what they're pointing to is the extent to which social comparisons in the modern world also get under the skin and impact our health. So what they're saying is that inequality seems to heighten people's social evaluation anxieties by increasing the importance of social status. And as those inequalities get bigger, so that some people count for almost everything and others for practically nothing, where each of us is placed becomes really important. And they provide countless examples in their work of how this process works and how social evaluation anxieties get into the body through things like the fight or flight reflex, which produces blunted and raised cortisol levels. So it's not just them that's saying this. There's a whole group of scholars who've been saying this for some time. Robert Walker points to a fundamental point in his cross-national comparison of the experience of poverty. He says that underlying the experience of poverty is shame. And on the basis of this, he makes some key points about it. Shame is fundamental. It impacts our ability to cope with the world. It undermines our agency. And Andrew Sayer, too, another author who's looked at this area, points to low-level shame as something that impacts the poor and the deprived and those who are disadvantaged. And of course, what we know about the digital world is where many of us really spend much of our time now. That provides huge opportunities for shaming as well. So this, I think, is fundamental. Moving to what's happening in America at the moment, two books that really influenced my thinking about all of this was one by Robert Putnam back in 2001 and one by Anne Case and Angus Dayton, which came out last year. Robert Putnam argued that one of the fundamental problems in America now was the decline of community, or what he called social capital. He said that was collapsing. Now, that was back in 2001. Angus Dayton and Anne Case have updated some of his arguments. And what they're arguing for now is that essentially capitalism doesn't provide for many of the groups in the population in America. They point to the stagnation in real wages that the bottom 10% have experienced. Also the destruction of a way of life which provided meaning, the destruction of the importance of family, community and religion, which has real impacts on health. And just looking at these figures here, America has seen a worse decline in life expectancy than we have in the UK. And key to that is what they call these deaths of despair. Suicides, drug overdoses, and alcoholism. They account for much of the increase in what they call deaths of despair. Increases from 65,000 in 1985 to 158,000. And I think the key thing for, particularly perhaps for this audience here, it's particularly marked in those who don't have university degrees. So if you look at this is US white non-Hispanics, aged 50 to 54. You can see those are the people with a degree, no particular increase in things like drug overdoses, suicides, and alcoholic liver disease. But for those without, there's been this huge increase in deaths. Fundamentally important, I think, that we grasp this and understand this. And that's if you compare the US with various of the other countries, industrialized countries around the globe, it is functioning much worse in terms of this than the others. So what does this mean? What does this mean? I put a question to you. Do you want to live in a world that produces these kinds of deaths of despair? Do we? If not, then I think this is a call to action. Alongside things like the climate emergency, and of course connected to it, as Barack Obama said, inequality is the defining issue of our time. We need to remember that our social position impacts our health and ultimately our death, not just through resources, economic resources, but through shaming social comparisons. And if we want to avoid these deaths of despair, then which we don't want to replicate in the UK, then we need to think about how we respond to that. This, I think, is a call to action, and that the hope for a decent life should be one for all of us. Thank you.